Hi, everybody. This is Reverend Dr. Jonathan Kuponukwong. We're here today with the Reverend Christina Shu, and we want to talk about chaplaincy, specifically hospital chaplaincy. So we're not going to cover military chaplaincy at this point, but we do want to find out what it means to be a chaplain. So, Christina, would you mind introducing yourself to us?
Hi everyone, my name is Christina Shu and I am a hospital chaplain at Cedars-Sinai Medical Center in Los Angeles. My call to ministry, I guess it came through chaplaincy. So I went to seminary, I went to Harvard Divinity School because I was initially interested in studying interfaith dialogue and comparative religion. And I was required to do some sort of field ed and never saw myself doing congregational work. So I applied to do a unit of clinical pastoral education, or CPE, and I just fell in love with the world of chaplaincy. I fell in love with getting to meet people from all different walks of life and hearing their stories and hearing what spirituality meant to them. It really fed my interest in learning about different religious traditions and different ways of being spiritual, but also added this element of helping people in crisis and really being there and witnessing difficult times in people's lives. I believe that Unitarian Universalists are excellent candidates for chaplaincy because we do have such a broad view of spirituality and encouragement of all people on their own spiritual path and their own spiritual growth. And I think that makes a really natural fit for chaplaincy, in which you are there to support people as they are and how they're making meaning out of really difficult life circumstances. And you also get to work with amazing staff members who bring their own perspectives to collaborate with people and taking care of people's health. You can get to work within healthcare institutions to advocate for greater justice, greater equality and inclusion, not only in religion or spirituality matters, but also in lots of other different cultural or ethnic ways. You can really help to kind of nurture the soul of your healthcare organization, and I think that is an amazing place to practice ministry. And then also, I think there are so many things that affect, will affect all of us, including aging, illness, disability, dying, and to get to be in those places with people, to get to see the type of meaning that they're creating, to see the losses that people experience, and to develop really caring relationships with them, even if it's for a very short period of time that they're in the hospital. I think that this is something that, as Unitarian Universalists, we excel in being part of life journeys and the way that people change and adapt their spiritual thinking to different circumstances and grow over time. And so as a chaplain, you get to really be part of that on the front line, so to speak. So that's part of what I really enjoy and treasure about being a Unitarian Universalist chaplain. Clinical pastoral education, or CPE, is a really critical part to one's formation as a chaplain. I had really great CPE experiences, both with my supervisors, or they're now called educators, and with the peer group, or my colleagues. And you spend a lot of time processing things with your peer group and processing things individually with your educator. So I've served as a chair of someone's internship committee who used a CPE residency for their internship, and we met virtually with some members of the committee served at the same hospital as the intern, and then myself and a couple other people sort of represented UU chaplaincy. It was a great experience because it was, to me, valuable in getting to help and support the formation of someone else who wants to be a UU chaplain. And it's always, I think, being on this type of committee is always like a good way to ask questions about what it means to be a UU, and how we grow as ministers, and how we claim our own pastoral authority as chaplains, how we develop relationships with other staff, how we develop relationships with patients. I think that one challenge for people using CPE residency as an internship can be creating the committee itself. And I've heard that from people that you are already in CPE, so you already have a pretty intensive educational program and deep relationships with your peer and supervisor, and then you need to ask some additional people to be on an additional committee to process more. So I think that can be a challenge, and I think people have done some creative things, like the committee that I was on, with pulling people together who could meet virtually, or pulling in other people like at your congregation who might work in healthcare, or that there might be some way that they could overlap, or at least know a little bit about what it's like to be a hospital chaplain. I also did a congregational internship, and there were some things about it that I really appreciated. And I guess as someone who grew up Unitarian, I do love our congregations and love worship and social justice and religious education. So in my internship, I got to experience a little bit of all of those things. And I got to teach OWL, I got to, preach sermons, see how a pledge campaign works, see how the board works. And I think all of those things are very useful, both in terms of understanding congregational life, as well as exercising certain skills and talents that I may not always get to use as a chaplain. So, I don't do any running services at my hospital, but I do occasional types of events like memorials, or services that support staff, or programming or planning for other religious observances. In terms of collegial support, I do find support with UU colleagues in my district or cluster, as well as people that I went to seminary with, and the UU chaplain group that I mentioned before, the Badass Chaplains, which was set up through a retreat for ministers in preliminary fellowship who are doing community ministry. But I also receive a lot of support through my own department at Cedars. So my hospital happens to have a really large spiritual care department. So we have about 11 full-time chaplains as well as CPE students. So I feel like I can talk to my colleagues as chaplains about a lot of day-to-day issues that come up, or questions that or cases I want to debrief. Because I'm in a palliative care team, we debrief a lot of cases together, or we'll ask for one another's advice. And I also had a UU chaplain as my mentor during preliminary fellowship. So I was able to talk with her about a lot of things related to professional career development, but also self-care as a chaplain, and my UU beliefs. So I feel like I receive support both through UU sources and non-UU. Self-care is a really important part of ministry, but especially important for chaplains. You are constantly witnessing and being present for people who are going through some of the most challenging and painful experiences in their lives, whether that is illness or tragedy or death. And we are receiving their stories and really receiving their pain, as well as joy and strength. And I think that means that being able to restore ourselves spiritually, physically, emotionally, mentally, to nurture our own relationships and community outside of the hospital, also to kind of attend to our boundaries and how we set those boundaries and are able to leave the work and our patient stories at the end of the day. All of those things are really important for sustainability as a chaplain.
Now that we've heard a little bit about chaplaincy from a ministerial perspective, let's take a look at the other side of it and explore what it means to be a chaplain without going through the fellowshipping process. Today we have Ben Gabel, who is the co-president of the UU Society for Community Ministries.
USCM stands for Unitarian Universalist Society for Community Ministries, and we support those who are doing UU ministries beyond our walls, beyond our congregational walls. So that definitely includes chaplains doing the work in the hospital or prison settings or any other kind of chaplains outside of the congregation. And we're launching a chaplain endorsement process, which allows for those who are called into chaplaincy to get a faith endorsement from your Unitarian Universalist faith tradition. The BCCI is the board certification for chaplaincy for folks who will get credentialed through the BCCI process, and the lay endorsement process with UUSCM will provide the faith endorsement for your board certification. What this endorsement process allows for those who want to go into chaplaincy, they can become an associate level certification, meaning that they can have 48 credits in a credit seminary program, and with 2 units of clinical pastoral education (CPE) units to become a associate level for a full certification that requires the 72 credits plus 4 units of CPE. And the faith endorsement process can go for either one, for the associate level or for the full certification. With the endorsement process, actually to eliminate your cost of going through the full MSc process, so that potentially will have some cost savings in your professional development by only doing 48 credits of seminary opposed to 72. And also it allows for your residency placement to count as your internship process, as opposed to doing an internship in a congregation. Your residency would in the hospital would count towards that. The application process to see the panel is $250 to see that, just to help offset the administrative costs. But overall, what we're trying to establish is to eliminate the financial barriers to entry as a professional chaplain.
So let's say, for example, that I haven't quite decided yet whether I want to go your route or I want to go the MFC route. Is there a way that I could go your route and then get endorsed by you and then go through the MFC process if I decide to at some point and become a credentialed minister?
Absolutely. This is you can go through our process to just get your faith endorsement for the chaplaincy. If you want to go for your full ordination as an ordained UU minister as a chaplain, that's still a pathway that's open to you with the MSc process, which is the additional layers of having not just going through your residency in your chaplain setting, but there's also additional readings with the MSc process that you might have to go through that may not be matches your calling as a chaplain. But however, that doesn't stop you from going through the full ordination process. What the lay chaplain endorsement process allows you to do is to serve as a religious professional, as a chaplain, with the support of your faith community.
That's good to hear. I'm glad it's not an either or kind of decision-making process. And is there still a body that I would go see, an endorsing body? Is there an interview of some kind? And how scary is that?
Yes. We will have an endorsement panel of 5 to 7 members who will there's an interview process that we will have that's similar to the MSc process, but it's just What this panel is trying to do is to see that you have been grounded in your ministry as a chaplain in Unitarian Universalism. So the questions might include, how does Unitarian Universalism informs you in how you do your chaplaincy work in the hospital setting? So it's really to help us understand as the panel, for the panel to understand that you have a strong understanding of Unitarian Universalism and how that informs you in your work as a chaplain. Your faith endorsement is good for 3 years, and we ask those who are successful through the endorsement process that every 3 years they would um, receive a renewal endorsement through the panel every 3 years. Find out more about the endorsement chaplain process on our website, uuscm.org.
Sounds good. Well, thank you so much, Ben, for sharing with us this exciting new initiative and ways in which we're making chaplaincy more accessible. One last question, by the way. Can you double dip? I'm already a member of UUMA as an ordained minister. Can I also join UUSCM?
Absolutely. We welcome our UUMA colleagues to join the UUSCM. If you join UUMA and the UUSCM, your dues to the UUMA are reduced by our annual membership dues, which is only $75 annually for UUSCM members. So that shaves off a little bit of your UUMA dues by $75.
Thank you so much for all the work that you do, Ben, as co-president of UUSCM, and we look forward to collaborating further in the future.
Sounds good. Thank you, Jonathan.